the question about what is good scientific support. So I think the underlying premise is that unless the drugs are being through regulatory authorities and been given a license, they are not supported by enough scientific evidence. And I would disagree with that simply because most of our treatments in MS have been repurposed. They've existed for other diseases. Some have come from, example, the cancer oncology space. Some have come from other autoimmune diseases. And before they actually get put into trials, it takes investigators, individual clinicians sometimes, to make a decision to treat MS patients with those therapies. And so, without that, what I would call individual investigator taking a chance and using a therapy in one patient, the second one, and then creating a little mini series and creating the scientific case, we just wouldn't develop treatments. And so it doesn't also apply to drugs necessarily. It applies to other interventions that are outside MS licensed therapies. It also applies to dietary interventions, exercise interventions. A lot of the time, starting off by using therapies or interventions that don't have a good scientific basis leads to a bigger scientific case, which allows definitive trials to be done for therapies to become accepted by the broader MS community. So I'm going to argue, yes, that is kind of how innovation works. Innovation often works small in a pre-regulatory phase, and eventually we get to regulatory phase.